My father was going to come speak today, but he had a choice. Speak here or save a life. He's still a busy heart surgeon at 77. I will get to him in a minute, but I want to touch upon what Dr. Beaver spoke about universal health. As you can tell from my accent, I am from America. I came from the most wasteful healthcare system in the world. Believe me, you don't want what we have. And I think what's pulling America back with regards to universal health care is Americans are spoiled. They want choice. But, if I had my way here in the Philippines, I think the sin tax should be 120, 200 pesos per pack. It's still relatively cheap to get cigarettes and tobacco here. And that's what keeps my father in business. I'm here today to talk about my dad. He's the reason why I'm here. But I'm here to talk about healthcare trends, especially in the home health and wellness sector. But before we do that, for those of you that don't know my father, he had this quote from his yearbook: "Great things come from small beginnings." Came from a small province in Binyan, Laguna, migrated to Washington, D.C., became a surgeon there, did his fellowship at the Cleveland Clinic, and was part of this heart surgery technique called bypass surgery. Came back to Washington, D.C., opened up shop, and 1975, 74, what is it now, 2018, 20,000 surgeries later, he's still growing strong. But he spends most of his time here. Humble man. Then one day, he had this crazy idea. He bought me a drink at the Shangri-La Makati, which had just opened in 1994-95, and he said, "Joel, why can't we improve the healthcare infrastructure here, especially in the hospitals?" Okay. Makati Med actually did that in 1969. Okay. But he said, "I need you to help me. I need a partner in this because I believe that if we build it, the others will follow." That was a turning point in my life. I am not a doctor. Like Richard said, I do have a Master of Healthcare Administration. And I fell in love with the industry. I fell in love with hospitals. I fell in love with healthcare. I fell in love with the complexity of trying to solve issues, trying to remain patient-focused. I've been here 17 years. Philippines is my home. And this man has a big influence. This picture was taken back in 1996, I believe, before the foundation of Asian Hospital came in. This is what it looks like today. And we went through a lot of growing pains. We had to really, literally build an organization from the ground up, recruit doctors from St. Luke's, Makati Med, Medical City, to form a medical staff. And like Dr. Beaver alluded to earlier, we had to go through some regulations. PhilHealth wouldn't accredit us because we hadn't been in business for 2 years. So how were we supposed to earn money? This was back in 2002. 16 years on, look what's happened. Rest followed. Look at St. Luke's QC, BGC. St. Luke's QC, I think, is also going through another master plan. You look at Medical City. Look at University of Cebu Medical Center. And there are many more. If you look at government hospitals, if any one of you has looked and been through NKTI and their new section, the equipment they have, you wouldn't think you're in a government hospital. So, what's the next big thing? 16 years on, Dr. Garcia and I are talking. I said, well, Asian Hospital did its job. He goes, Joel, what do you think we can do? I said, well, Dad, I'd like to keep people out of the hospital. Okay. Ironically, I want to focus more on the health and wellness end. And so he decided to put up a company that will specialize in personalized home health care. This is our view of our clinic. I use the clinic, though, as a nerve center so that my doctors and nurses can keep track of all of my home care patients. But first, what's home health? Home health traditionally is medicine in the home, right? Well, it's not exactly like that. It's not just sending a warm body over there to look after you. It has many, many components. Assisted living for people that need help doing the chores, maybe making the bed, going to the bathroom, going to the grocery. It could be sending the physical therapist to do your rehab session there. Or it can be more of the alternative medicine, sending an acupuncture or acupressurist there for holistic health. It can also be medical visits, routine medical visits for people that have chronic diseases. A nurse or a doctor would stop by every week, check on how you're doing, and report back to the clinic. Home health also can be 24-hour care for people that are of old age, massive stroke, or debilitated. Personalizing it. My vision was paying attention to detail. How do we do that? Well, aside from the patient, look at the family needs. Where are the kids? Are they in the Philippines or all over the U.S. or all over the world? How will they be informed of their loved one, their mom, their dad, their lolo, their lola? The staff, nurse, and caregivers' needs. What kind of tools do they have in terms of equipment, software, to also not only take care of the patient, but to also document the patient in an electronic medical record that my staff and doctors can see? Right? Doctors' needs. My doctors and the primary care doctors of the physicians. What information do they need to render care if necessary? Another thing that's overlooked, household help. Your maids, your drivers, your nannies, your companions. What do they know? What do they know about first aid? Do they know to go to the nearest hospital? Do they know where the nearest ER is? Okay. So personalized home health, paying attention to detail. Now, let's not forget the center of it all, the patient, customizing the patient's needs. Medical, it's a given. Clinical, medications, follow-up appointments. The wellness part. Do these patients like alternative medicine? Do they like acupuncture? Do they like therapeutic massage? Do they like taking certain Chinese herbal or Chinese medicine? But here's one aspect I think that doesn't get enough attention, is the mental aspect. And what do I mean by that? When you receive a patient for home care, no matter what age or disease they have, what do you know about their family history? What do you know about their job? What do you know about their likes, their dislikes, their hobbies, favorite food, music? Highly overlooked. How do we put this all together? Okay. At our company, we have a saying. Use technology with teamwork, compassionately. Okay. And again, the technology component, I'm from the IT realm. But I'm not a techie per se, but I see it as an important component of tracking information. Teamwork, you work within a system. In home health, you just don't send a warm body. You just don't send a nurse to look after you and just document things on paper. You need, in order to be effective, you need a system. And compassion. This is one thing that truly amazes me. In my 35 years of living in the States, I had the opportunity to visit hospitals in the biggest cities and the rural cities. And the one thing I found common, Filipino doctors, nurses, rad techs, med techs, out in the middle of nowhere. But you see them in action. And the one thing they all have, especially nurses, is compassion. It is something that I really cannot explain, but just comes naturally. And now you know why we have so many nurses that are in demand globally. So, does customized home health work? Well, let me share with you a couple of cases that we've taken on. First case, 79-year-old male. He is actually a doctor. He's still a practicing doctor. Had a bad case of pneumonia. Given less than a 50-50 chance. By the grace of God, he survived. Family from the States called me up and said, hey, he has no family here, he has no driver, he has no maid, he's very independent. Can you help him get back on his feet? Because he does not want to go back to the U.S. I said, absolutely. Came up with a 30-day rehab program, intensive rehab program, so that he can get back to his feet, so that he can get back and golf and travel and go back to being a doctor again. He had the drive to get better. His mental state was, I need to take care of my patients. You know what he did? Completed the program in 21 days. 21 days. He's back on the golf course. Second case. 75-year-old. This is an interesting case. Filipino lived many, many years in the Pacific Northwest. The family talked to us. We spent 4 months prepping for this guy, going to the house, making sure that the house was ready, had a lot of safety features, talking with the doctors in the U.S., charting everything. And he didn't come. And he kept postponing. I talked with the family members. I said, is he coming? He said, yeah, he is, but he has a concern. He has Parkinson's, has heart disease, can't move around like he used to. I said, okay, well, that's degenerative. I don't think I can do much about that. What did he like to do? Well, he liked to play golf. Okay, what else? He's a passionate sports fanatic. Okay, I'll tell you what, there are a lot of apps out there where he can follow all of his sports teams. Basketball, college basketball, football. And ironically, that was the kicker for him coming back. But, we took care of him with a combination of male nurses and caregivers. This was in a home setting. The previous one was in a condo setting. So we're flexible, but one thing we do, the one thing that's necessary in home care is preparedness. This is one of my favorites. 62-year-old female pharmacist, massive stroke, lived in a family compound. The daughter oversaw her care. Ironically, the daughter was also 6 months pregnant. She became our patient because we had to look after her. And ironically, when the baby was born, she couldn't find a nanny, so we looked after the baby. So this one home care patient generated 3. But there were goals that were set. The daughter said, I want to travel with my mom again. I want her to walk and try to be as independent as possible. A picture is worth 1,000 words. So she gave birth to her first son. And you can't really see it here, but the look on her face looking at her grandchild makes it all worthwhile. It's my staff. We were invited to the first birthday party. Key success factors. One is communication, constant communication with the family, the patient, the doctor. Second, a care plan that's not only approved, but flexible, because things can change. Patience with the patient. Okay. Your patients, no matter how old they are, will have their good days and bad days. They will cancel their appointments, they'll cancel their rehab, they'll cancel their blood tests, having to reschedule everything. But at some point, you do have to comply. I think the biggest key success factor in most of the patients that I have handled is the patient's willingness to get better. And if you can identify that, you'll be okay. But if you can't, take a step back. Again, look at the mental health aspect. How did this patient live? Is he or she widowed? He or she suffered a loss that affected. Are they depressed? And another key success factor that, fortunately, I think really, really works when you pay attention to details, emergency preparedness. Okay. Two of these patients under our care had an emergency to go to the hospital, but we had a system in place. We had a system in place with an access to a doctor. We had a system in place for contacting the primary care physician. And it's not all smooth sailing, okay? There will be issues. As long as you have a system in place, you'll be okay. Challenges. Well, when you're doing telemedicine consults and you're doing endorsements, telecom and internet connectivity come to mind. So what do? Worst case scenario, telephone call, text message instead of a Viber or WhatsApp message. Logistics. Traffic can be horrible, especially at this time of year. Flooding can be doubly horrible, where our nurse or caregiver has to stay on site, but we're not going to leave them. Keeping good people. The Philippines, on average, loses 19 to 20,000 nurses a year to going abroad. People think it's just the U.S. and U.K. Actually, the hot spot now is Germany. Another challenge, protection of patient privacy. Hospitals worldwide are actually very vulnerable to this. So you have to instill it in your staff that whomever you take in, you protect their patient privacy. Those pictures I gave, I had to ask permission. For that one slide I didn't, said, I prefer you not use my name or any picture. I said, fine, fair enough. Okay. There are also challenges with regards to modern medicine conflicting with alternative medicine. Sometimes you'll have clients that will see a Chinese doctor and a Western doctor. And oftentimes, sometimes the patient will favor one over the other. Future trends. What I see better telecom, which means telemedicine, being able to do video calls. If the doctor cannot get to you in a timely manner, do a video call. Perfecting personalized care. There's always something to improve. Always. I see home health as a better extension of the hospital. I see the use of apps. Actually, you see apps like AID that have a doctor or nurse. You have apps like Xenia that have therapeutic masseuses on standby that go to you. But I also see more acceptance and usage of alternative medicine, some people call it complementary medicine, within the home care setting. Concluding thoughts. Well, I agree with Doc Beaver. These are exciting times in the Philippines, irrespective of your political views. Okay? People are investing in healthcare. There are more healthcare projects, healthcare startups. Patients and consumers have more choices, which is great. But, and I'm going to take a blurb from last year's speaker, I believe she was Dr. T. Something in her presentation really struck me. Why is it we don't put priority on our health care, our own health? If I were to take a show of hands, how many people here feel that they're in good health, bad health, so-so health? How many people have a good diet? How many people exercise? I'll end with a quote from J.K. Rowling. It's our choices that show what we truly are, far more than our abilities. It was a choice for Dr. Garcia to come back and set up Asian Hospital. It was a choice for all of us to be here today. It's a choice to make new friends, to learn new things. I urge you to make a choice to put health as your priority. Saying goes, health is wealth. And what I would like more is that you take care of your health, you live longer. If you live longer, you'd make a difference in our healthcare system moving forward. I'll leave you with that. Thank you, and good morning.